Hey guys, welcome back to Honesty's channel. So today we're going to talk about knowing the signs of early labor. I am currently 36 weeks pregnant and I am having my scheduled C-section on October 20th. So I am preparing myself to perhaps going into early labor myself. I have already a scheduled C-section for him to be born a couple days early, but then everyone's telling me like they think that I'm about to pop, and even the doctor and medical assistants keep reminding me that it can happen at any time. This is my second child and I could be having this baby earlier than I'm expected. I mean, it can happen tonight, it can happen tomorrow, at any point. So, especially when you're already this far along in the pregnancy. It's good to know the signs if it's time to give birth or just a false alarm like Braxton Hicks. So learning early signs of labor, how to tell if it's a true labor or false labor, can be really helpful. So what the early signs that your body is preparing for labor, you may notice the following symptoms or signs in the final days, weeks, or even a month before your due date. The baby drops. So if this is your first pregnancy, you may feel what is known as lightening a few weeks before the labor starts. It means your baby is now resting on your lower pelvis, in your pelvis, and you may feel less pressure just below the rib cage, so it will be easier to catch your breath, breathe easier, and if you've experienced heartburn like me during my pregnancy, it might start to improve, and for your sake, I really hope it does. If this is not your first baby, however, the lightening might not happen until the labor begins. You may have more Braxton Hicks contractions. More frequent intense Braxton Hicks contractions can be a sign or a signal of pre-labor, which is when your cervix starts to thin and widen, setting in for the stage for the true labor to begin. The cervix starts to change in the days and weeks before delivery. Changes in the connective tissue of the cervix make it soften and eventually thin and open. Now, the thinning of the cervix is called the effacement, which is the opening, and the opening is called the dilation. So if you've given birth before, your cervix is more likely to dilate a centimeter or two before labor starts. But just to keep in mind that even being 40 weeks pregnant with your first baby, a 1 centimeter dilated is no guarantee that the labor is imminent. Especially if you're having a vaginal birth, you could be in labor for hours or days. Every baby is different. Every mother and woman's body is different. So, when you're at or near your due date, your doctor or midwife may do a vaginal exam during the prenatal visit to see whether your cervix has started the process of effacement or dilation. Now, even though I am having a scheduled cesarean, if I go into labor early, I'm just going to have an emergency C-section. So it will just, either way, I'm going to have surgery and not a vaginal birth. But I could still go into natural labor beforehand. You may pass your mucus plug. So if your cervix begins to efface or dilate significantly as you get close to labor, you may pass your mucus plug, which a small amount of thickened mucus that's sealed off your cervical canal during the pregnancy. It may come out all at once, like a lump, or as an increased amount of vaginal discharge over the course of several days. And you may have some bloody show when your cervix starts to soften or dilate. You may notice a pink discharge or even a bright red blood in your underwear. If this happens at the same time you use your mucus plug, The mucus may be tinged with blood as well, but it can also happen on its own independently. Now, if I have not seen any blood for this entire pregnancy, like for like 9-10 months, I haven't had any period at all. So if I see any blood, I am going to the hospital immediately. Even if they tell me it's not a concern, I would be concerned personally, even knowing that it could be the mucus plug. It is a sign of going into labor, or if you are not in your third trimester, it could be something else. So it's always good just to make sure, for sure, that you're not miscarrying. Now, heavy bleeding, if you have significant bleeding, like you're bleeding through a pad within an hour or so, I would definitely, for sure, go to the hospital if you have not already gone to the hospital after a little blood. What are signs that labor is about to begin? Labor could be imminent if the baby drops, as lightning can happen right before labor, especially if this is not your first baby. You pass your mucus blood. Sometimes this happens within days or weeks before labor, depending upon your cervix opening. Or you have the bloody show and the heavy bleeding. Now, if your water breaks, when the fluid-filled amniotic sac surrounding the baby ruptures, the fluid leaks from your vagina. And I've talked to a lot of my friends that are moms that have had their water break. Since I didn't have my water break with my first child, my daughter, they had to puncture it themselves at the hospital. I wanted to know, like, how do you know when your water breaks? And they describe it to me as like they know they're not peeing themselves and it's not urinating because it just like all comes out like gushes at once, and like it does not stop. It doesn't trickle like pee would, and it just like keeps pouring out of you. And they said you'll know that it's not urine. But then other women, whether or not say that it comes out in a large gush or a small trickle, they know that it's different than being pee. And this is definitely a time that you need to call your doctor or get a ride to the hospital. Some of my friends have even driven themselves to the hospital. And a good tip, if you're going to do that, is put a towel under your seat or a pillow that you don't care if you get all soaking wet while you were doing so, because you are going to get your seat wet. Most women start having regular contractions before their water breaks, but in some cases, the water breaks first. So just read up on it, talk to any friends or family members that you know that have had their water break before so they can give you their input and experiences. So what are the signs that labor's begun? Now, you need to time your contractions. Contractions have become increasingly intense. When your uterus contracts, your abdomen feels tight or hard, and you may have the sensation of like cramping. When the uterus relaxes between contractions, the sensation dissipates. Labor contractions will grow stronger, longer, and even more frequent as they cause your cervix to dilate. And I asked my doctor, like, am I going to feel contractions in my stomach or my vagina? And like, he told me that it's going to like feel lower in my lower abdomen. So, I mean, that's like in between your stomach and your vagina. Wasn't really the answer I was looking for. Doesn't make it any easier for me to wrap my head around. But they say to like time the contractions that you're having them frequently every 5 minutes within an hour, and then it's time to go to the hospital. Make sure that they're not Braxton Hicks false labor contractions. You may have the sign that labor has begun if you have lower back pain or with the rhythmic cramping. Some women experience intense pain in their lower back during or between their contractions while they're in labor. The back pain usually means that your baby's head is pressuring against your lower back, but some theories propose that the pain may be referred from your uterus to your lower back. So labor usually it can start between 37 weeks to 42 weeks. During pregnancy, a full-term labor is 40 weeks. So either you're having labor early or you're going to have a late baby. Preterm labor, if you're having science labor before the 37-week mark, you may be going into what's called a preterm labor. So get to the doctor or call your doctor right away. Though you will feel comfortable to know that like between 35 weeks and 36 weeks, even if you go into a preterm labor, the babies usually are just as healthy as full-term babies. They just may need a little longer time in the hospital. So is nesting a sign that I'm going into labor? Probably not. I mean, unless you could have been nesting the entire pregnancy, frankly. There's no good evidence that nesting means you're about to go into give birth. Many expectant moms just feel the urge to clean and organize things at home and just get the home ready for their baby. But this could happen like even months before labor starts. How can I tell the difference between true and false labor? Now, this is really important. It can be hard to tell at first. The frequency or the intensity of the labor and the location of the contractions can be very helpful to know how to figure them out. If you're having true labor or just having Braxton Hicks contractions, how changing positions, walking, and the rest affect your contractions provides even more clues. Additionally, if you notice any bloody show with your contractions, then they're most likely true contractions. So there are ways to know. With false labor contractions such as Braxton Hicks, it's all about the timing. They're irregular and they don't get closer together over time. Now, if they are true labor contractions, they're going to happen at regular intervals and get closer together over time. That's why most doctors and medical practitioners will say, time your contractions for at least an hour before you come into the hospital. Now, the length with Braxton Hicks, they can vary in length and they don't get any longer over time, fewer than 30 seconds or up to 2 minutes each. If it is a true labor contraction, the length is going to be starting to last longer with each contractions for about 30 to 70 seconds each. So really, again, with the timing, just make sure you're timing it. With false labor contractions such as Braxton Hicks, the intensity is weak and it doesn't get stronger with time. It may be weak and then strong and then weak again. But if it's a true labor contraction, it's just going to keep growing stronger and more painful with each contraction. So keep track of the pain and the intensity as well. Now, the location of Braxton Hicks are generally felt at the front of the abdomen, but with true labor contractions, they may start at the back and move to the front or radiate down into your thighs. The effect of moving and resting with Braxton Hicks contractions, they stop when you change your position, walk, or rest. But if it's a true labor contractions, they generally continue even when you change the positions, walk, or rest. What to do if your water breaks? Call your doctor and let them just talk it through with them. Labor will probably start soon if it hasn't already, or just get yourself to the hospital. If you've been tested for Group B strep, your provider will probably want you to head to the hospital as soon as your water breaks so you can take the antibiotics. The provider may also ask you to go to the hospital right away if you've been having pregnancy complications, the water's broken, Or if you notice the menoconum, it's like a greenish or streaked with green in your amniotic fluid. Now, what happens if your water breaks and you're not feeling any contractions? If you don't start having contractions on your own within like 24 hours, your provider will discuss the timing with you. Just call your doctor. They'll most likely recommend that labor be induced because the baby's more likely to get an infection without the amniotic sac's protection against germs. That's in case you decide not to go to the hospital right away, but I would recommend that you go to the hospital as soon as that happens, because you're probably going into labor, and every labor is different. Um, Depending upon if you're having a cesarean or a vaginal birth, you could be having your baby at any time. Every woman's body is different, and every birth is different. When should I tell my doctor or midwife that I'm in labor? Now, towards the end of your pregnancy, your doctor or midwife will most likely give you clear guidelines about when to let them know that you're having the contractions and when you should go to the hospital or birth center. But if you feel like you are having the baby, it is mother's intuition, and you get to the doctor as soon as you feel like it is necessary to get to that doctor. Some hospitals will try to turn women away and say, oh, well, you're not dilated enough. But, you can always put your foot down and say, I'm having this baby. Because I've spoken to a lot of my friends who that's happened with, and they were always right. And they decided to stay at the hospital and put their foot down and say, nope, baby's coming. I know baby's coming, because that's their mother's intuition. Now, instructions will depend on your individual situation, such as whether you have a high-risk pregnancy or other complications. If this is your first baby, or you've had multiple children already, if it's your second baby, and how far you live from the hospital or birth center, all come into play. If the pregnancy is uncomplicated, then you'll probably have to wait until you've had the contractions, at least for about a minute each, and occur every 5 minutes for about an hour before you come in. If you're unsure whether the time has come, just go ahead and call the doctor and let them know what you're feeling, or it can't hurt to drive to the hospital or get a ride. When you call, your doctor or midwife will give you some clues about the condition from the sound of your voice. They'll want to know how close together your contractions are, how long each one lasts, how strong they are, like whether that you continue talking through a contraction or if it's really hard for you to verbalize. If you think that your water's broken, and if you're feeling the baby move normally. Pregnancy warning signs to look for. Call your doctor or go to the hospital right away if your water breaks or you have contractions before the 37-week mark, because you could be going into the preterm labor. Other signs of preterm labor include vaginal bleeding, spotting, unusual vaginal discharge, abdominal pain, pressure in your pelvic area and or lower back. If the water breaks or you suspect that you're leaking the amniotic fluid that's like yellow, brown, or greenish, the signals of the presence of menoconum or your baby's first stool, and this is sometimes a sign of fetal stress. It's also important to let your provider know if the fluid looks bloody. If you notice that your baby's less active, you have vaginal bleeding, constant severe abdominal pain, or a high fever, and you have symptoms of preeclampsia, including abdominal swelling, severe or persistent headaches, vision changes, intense pain or tenderness in your upper abdomen, or difficult breathing. Some women assume that symptoms and discomfort are just part of the partial of being pregnant, when others worry that every physical change spells trouble. So knowing which pregnancy symptoms you should never ignore can help you decide whether to call your doctor or midwife or rush to the hospital. That being said, every pregnancy is different, and there's no list that can cover all of the situations. So if you're not sure whether a symptom is serious or not, or you're just feeling like uneasy and you don't feel like yourself, trust in your instincts and trust in your motherly instinct. Call your healthcare provider or go to the hospital. If there's any problem, you'll get help. If there's nothing wrong, you'll be reassured. And it can't hurt to try to reach out. So I congratulate you on your pregnancy and hope that you have a healthy pregnancy, whether you go into preterm labor, you're going into labor just a little bit early, or if you have a full-term pregnancy or even a late labor. Congratulations and welcome to motherhood. Fathers, welcome to parenthood. And this is an amazing journey that we are all sharing together and keeping the world go round and giving life and birth. And it is one of the most amazing things ever to be able to give birth and be a parent. So, congratulations. Thank you for tuning in to Honesty's channel, and I look forward to hearing all of your comments. If you have any advice for me during my pregnancy, or just would like to send me a message or shoot me a comment, please go ahead. I also give shout outs, and I would love to hear from my viewers. Thanks again for tuning in, and I will see you all soon in my next videos.